You are looking at pure potential. A child is born with hopes and dreams of a successful life. Those dreams, however, need to be nurtured with proper nutrition, a stable home life, and preventive health care. Without those components, those hopes and those dreams can be dashed the moment a child enters kindergarten.
For every child who's born, we as a society ultimately have a responsibility to care for these children and to make them productive human beings, because if we don't, we as a society will pay for it later on.
In national studies, they've characterized the quality of care from birth to 5 as largely mediocre in the United States. It's not something we've invested in much as a society.
When you look at the high percentage of kids, I mean, if 20% of kids get to school not ready to learn, I think that's a crisis.
Brain development is so critically important. In the first year of life, we often are unable to see the effect of the lack of stimulation on the IQ, for instance, as much as we can as time goes on. And the difference between a stimulating and non-stimulating home becomes so critical and becomes so obvious as time goes on.
Child psychologists say that brain development can often hinge on a child's upbringing. In the extreme case, abuse retards brain development, while constant reading, playing, and nurturing enhances brain development.
Because the brain is such a sensitive organ and so sensitively tuned to what it gets from stimulation, that the more appropriate stimulation it gets earlier, as it moves ahead, it lays down the appropriate structures to then be able to deal with things later on that are harder. If those experiences don't accrue at 12 months, at 24 months, then oftentimes the learning environment has to work harder at 3rd and 4th and 5th grade in order to compensate for the lack of experiences early.
Every day of a child's life builds towards his future success. Every day that he doesn't have a positive impact, then he has a day of catch-up. Lots of catch-up days means that a child gets behind.
That means there must be a partnership between parents at home and childcare and pre-K professionals. This requires constant communication so parents can learn from teachers and teachers can understand each child's specific needs.
Investing in the quality of environments that are provided to children birth to 5 have a noticeable return downstream in terms of kids' achievement, their lifelong outcomes, even things as much as criminal behavior and the like. A couple of long-term, highly respected studies have been able to determine that we get anywhere between $2 for every dollar invested as a return, up to somewhere in the range of $13 to $15 for every dollar invested. And every single one of those studies has demonstrated a return on investment greater than 1.
Yet many parents cannot afford either a pre-K environment or the appropriate preventive health care that can position a child for learning. In many cases, parents who come from impoverished or uneducated backgrounds have not learned the right way to prepare their children to reach their potential.
It is very clear that investment in early childhood programs, in the early parenting skills, in the early social-emotional development, in early preschool programs, again, hardwires a baby's brain to learn, and these are the children that go on to be successful.
The holes are huge.
It's strikingly clear that there are very large swaths of our population that are children and families that are stressed to a breaking point. And it is the right thing to do for the community to rally around those families and kids and provide the best that they can for those kids at the earliest possible ages.
It's possible to repeat a grade in school, but it's not possible to repeat ages 0 through 5, a time when the brain is experiencing its most expansive growth and development. That's why investing early is critical.
Our healthcare system, I think, understands the importance of those years, but we need to make sure and support them in the ways that they do get all of our children to kindergarten healthy. There are many constituencies we're going to have to bring into this fight, and my vision is that they all get that it's important to maximize that potential of every child.
There's still a substantial number of at-risk students that are not being served. The recent advent of the Early Childhood Foundation is given another whole dimension to the efforts to bring resources together. And so I think Virginia is moving toward a more complex delivery system that will make early childhood services available to a much larger number of children than had previously been the case.
Even starting the Virginia Early Childhood Foundation has been a really important part of Virginia saying that we are investing in our young children, and we want to close the gap between those who are ready and those who are not ready in kindergarten.
When we start early, when we fully develop the potential that nearly every child possesses, we create a smart beginning for that child and a bright future for our Commonwealth.